All right. The Australians, meanwhile, have done their own thing. And one of the ways we manage difficult concepts and experiences is by making diminutives out of them. And this is a national thing. I have a database of more than 6,000, and we use them to indicate that something is part of the space that we inhabit and we're comfortable, or at least more comfortable with it. So ISO is self-isolation, the Rona is corona, quasi is quarantine. And you might ask how you get from quarantine to quasi. Well, names with an R after the first syllable, like Murray, become Muzza, and Terry becomes Tezza, and Sharon becomes Shazza. So quarantine becomes quasi. And it's part of a regular pattern in Australian English and is recognized by Australians and is totally incomprehensible to people overseas. Sani is hand sanitizer, Soch Disti is social distancing, and the Pando is the pandemic. Magpies are people who have been supermarket hoarding, and you might have seen the phrase to do a Bondi, which is people turning up on Bondi in large droves close together when they're told not to. But what you will hear, if you're lucky, will be things like, oh, crumbs, sorry. Me mum's tested positive for the Rona, so we can't Sochi Disti this arvo. The fam's in ISO. Can you run to Coles and get me some Sandy? Our local's been hit by the magpies. That sort of thing is actually more common than you might think. And it's part of the way in which we react to, if you like, threats and make them, we pull their teeth. Here's another example which I want to show you. Now, Vietnam was interesting. They had a very bad experience with SARS, which was 2003. And so this nation of 95 million people locked down before pretty well anyone else. The news about COVID came out through some news out of China. The people in Taiwan wrote to Wuhan and say, we hear you've got a nasty respiratory thing, tell us about it. And as soon as this became a little bit public, the Vietnamese shut everything down. And as a result, they have 0 deaths and 328 infections. Our figure is 103, as against 7,221. We've done extraordinarily well. People I've talked to who know about Vietnamese public reporting say that these numbers are probably real. And this is how they did it. A whole series of special posters, postage stamps, signs in the streets and so on. And the sign underneath this in Vietnamese says, to stay at home is to love your country. Notice how they're ringing the nationalism bell. Both of the characters have got a national flag on their left breast, which is where you carry it. One female, one male, both in masks, one a medical worker, holding hands high for triumph over an evil in red in the background. The symbology is very clear, but the Vietnamese did this in a number of different ways. Here's another one. And the Vietnamese on the poster says, fighting against the epidemic is like fighting against the enemy. Now, remember, the war in Vietnam ended in 1975, and there are a lot of people there who still remember what war conditions were like. Wear a mask regularly and properly. That is necessary to prevent the COVID-19 epidemic. In other words, they're pushing this at the people, and my former colleagues, current colleagues and former students in Vietnam told me that every day they would receive an SMS and/or an email from the Ministry of Health, the local body, local health administration people, the local hospital, Hanoi, various instrumentalities like their university, asking how they were doing, you indicate anything we can do for you, here's where to contact if you need any help. And they have done it in a very, very orderly way. It's worth asking which countries have been successful and why, if we can come up with an answer. First of all, the places which have done well have had an appreciation of science and medicine, and this I think is very important. There has been a lot of challenging of the science in, say, in America, in Belarus, where the president says all you got to do is drink lots of vodka, in Brazil, with awful results. But the places that have done well have listened to the science and accepted it as a true and guiding principle. The good ones took early, decisive action, especially Taiwan and Vietnam. And there's been public collaboration and consensus among the populaces that have been asked to fall into line. Also, these places have managed their messaging very well. And the successes, as I said before, are Confucian countries in Asia and Australia and New Zealand. What's a Confucian country? Confucius, Kung Fu was a Chinese philosopher who lived from 551 to 479 BC. And among other things, he wrote a book called The Analects, which are rules for a moral life. The Chinese Empire once included Japan, Korea, Vietnam, and Taiwan. And as a result, all of these countries, even though they now have very different forms of government, still follow a broadly Confucian set of values, which are obedience. People obey the emperor. Wives, sorry everybody, obey husbands. Children obey parents. Social harmony is a major leading principle and cohesion of the society you live in. Now, in places like China, they've had a strong centralized government which has been able to impose very effectively strong measures to limit the spread of the disease, mainly around Wuhan. And in other places, say like Korea and Japan, where they had democratic systems, there's been a kind of social compact. The government delivers competently and the people will collaborate. So why have Australia and New Zealand done so well? Here, there is a risk of stereotypes, all Aussies and New Zealanders are like X. But we can get some idea about what this means by looking at places we are not like, the Americas, Africa, and South America in particular. And in the USA, I'm afraid, the rhetoric has been such that the people and the views and the science have been polarized, antagonized. There's been a lot of blame seeking, and the leadership has been very confusing and inconsistent. And the science itself, in the presence of Dr. Fauci, has been undermined so that people really don't know what to believe anymore. And Brazil and Belarus are in the same sort of basket. In Europe, the most successful country has been Germany, and I would note that Angela Merkel has a PhD in science. What have we done? I think there are three ways of putting together this, and they all work around the notion of how language is used to get the message out. First of all, consensus. I think we have a cautious but rational belief in expert science. In other words, rather than deriding it, as has happened from the White House, we are, I think, willing to listen to fair argument and to believe things which we believe are honestly and openly argued. And as a result, we've come to a realization and agreement that there is a shared threat. Most importantly, and very maturely for our democracy, COVID has not been politicized, unlike climate science, which has been politicized and where the debate has become enormously murky as a result. And also, because we have a consensus, we don't have to do what the Chinese did and have police on the streets making sure that people are at home. We have basically done it ourselves. Second, I think our leadership has been believed and respected. There has been a kind of matter-of-fact tone of public discourse from people like Daniel Andrews in Victoria, who's been probably the standout premier in performance during this period. Reminded me of Anna Bligh in the Queensland floods in 2011. And Dr. Jeanette Young, the Queensland Chief Medical Officer, has done a very steadfast job in telling us what's going on and what we need to know. And third, of course, is the idea about mateship and solidarity. We are very good at mateship in this part of the world. We're not the only people that practice it, but we do it in a way which I think is more far-going and open than in many countries I've known and visited in and lived in. We know how to collaborate in diversity, and we recognize that sometimes sensible self-denial is in everybody's best interest. And so we have, in fact, self-isolated, and we have done social distancing and all the rest of it. Also, I think we are less ideological, for example, about freedom. There was a piece of video on the box the other day about an American who was trying to come into a store not wearing a mask. And the man who worked in the store said, "I'm sorry, sir, you can't come in." And the customer said, I woke up this morning in a free country. I'm going to come in without my mask. They didn't resolve it. Also, there is a story about Lance Armstrong, which I rather like. This was during the floods. He was here in Adelaide, riding with the Tour Down Under, and he actually came up to Brisbane to lead a charity ride to raise money for people who'd been flooded out. And at the end of the day, he said, look, I don't know what you guys are doing, but it's quite different from New Orleans. When Katrina came through, the roads were choked with people trying to get out. And in Brisbane, the roads are choked with people trying to get in to help. And he said, I don't know what you're doing right, but you've somehow found a key to something which is important. Okay, so I'm going to wind this up now. What should we do? Well, there will be a next time. There will be a COVID-3 and 4 and others. And so we need to anticipate the scenarios which are bearing down on us. The messaging needs to be coordinated and multimedia, and this has been done pretty well. We've had the TV, we've had the social media, we've had people like the Wiggles, we've had newspapers and public signing, and our public figures, and teachers and students and public servants and people who work in the private service, private enterprise, all doing the same thing and passing the same messages. But the messaging that we need to plan, and next time we don't want to invent it as we go, we need to have a, if you like, a grab bag of these things ready to plug in and go. It's got to be timely and instructive. It's got to be impactful with clear and memory sticky so that we remember it. And it's got to be consistent. There has been quite a bit of difference in interpretation between the states and the federals in Australia, which we could have done without. It needs to be factual and trusted. It needs to be cohesive and reassuring, including the safety net. And keep it simple, stupid. Don't be too fussy. New Zealand had 4 simple stages of lockdown. Everybody understood what they were, and everybody knew what happened as you moved from one to the other. And finally, the science. You need to share the data. The one thing that we're having trouble with at the moment is the closed borders issue. And the closed borders issue is being put to us in the context of, there is science, sorry, in the background you'll hear my Siamese, ignore him. You will hear the people saying, look, the science is telling us we need to keep the borders closed in order to secure the populace of this state. But they haven't shared the data and we don't know what it is. And this is the point we start running out of belief. So that's an important lesson. The thing, well, for something like COVID, it's very easy. Isolating, distancing, protect the health services so they don't get overloaded, and tracking so that you know who has been in contact with whom so that we can isolate people who are potential carriers of this, particularly the asymptomatic ones who don't have symptoms. And we need to agree on goals and priorities. Are we going to save lives? Another slide that I had earlier said that someone from the Financial Review had worked out that each life saved was about $6 million. Now that's an interesting number. We ought to have a debate about that, and the facts ought to be brought out, because it's a kind of balancing act between lives, quality of life, and economy and jobs. Remember that in America, is it 40 million people have lost their jobs, and when you lose your job there, you generally lose your medical insurance as well. A lot of people are dreadfully exposed. We need to prepare and protect the health service, and we need to fund it properly so that it's ready. And we need to think about the consequences of limiting social contact, because if you take people, and we are after all social animals, and tell them that they can't hug, they can't touch, they can't shake hands, they can't get together closely for coffee, this has an effect on how you feel. So we need to think over the longer term about not only the economic, but also the social and psychological effects. And the very important fact that young people will be the ones who carry the burden that is being now created, and they're going to have years in which they're going to have to work hard to try and fix it. And that, dear, I'm having trouble with this thing sometimes. That is it. Save lives, people. And I'm now going to stop sharing. Yeah, it's a lovely question, because Anzac Day is one of the ones where most Australians across the spectrum get together. No, you and I have been down to the Anzac Day thing at Bellbowrie, and all sorts of folks expressing a common fact that we belong here, we like being here, and we respect the folks who died in order to make it possible. So there was a particular poignancy and irony in the fact that Anzac was smack in the middle. And it forced us, I think, to think about Anzac Day in a new way. Now, that's something which is important, because you can, I suppose, become a bit too accustomed to doing things in a certain way. If someone takes away your ritual, you need to think about the reasons why you're doing it in the first place. And I would expect that next year, Anzac Day will be huge. A remarkable person, and in fact has been getting very positive press right around the world, because it's an example of caring leadership, and one which is able to communicate with people across the spectrum, apparently very directly. Yes, she keeps her language simple and she does repeat things, but she does it in a way which I think is well judged. And as I said before, the New Zealand 4-step state of lockdown, everybody understood perfectly well what they were and what it was to move from one to the other. So I think the New Zealanders rather quickly got onto the fact that you need to be simple and direct in your messaging, open in your information, persuasive in the rationale for what you were doing and where we're all going. Australia got there a little bit late. The first meetings from our leaders, where they got on the TV and told us about it, were rather rambling and confusing. I think the Kiwis were lucky in having a particularly clear-minded leader. I also have a vested interest in New Zealand. I lived and went to school in Christchurch for 12 years, so I understand the place to some extent from inside. And I think that the fact that we might now have a Tasman bubble, as they call it, I prefer the word cordon sanitaire, which is much more classy. In other words, they and we are very successful at managing COVID, and there's every reason why we should have an area where we move freely between our countries. Cordon sanitaire, by the way, is French, and it means a health barrier, and it was used, among other things, between Spain and France to keep yellow fever from coming from Spain into France around about 1890. Now, we're not doing that, but it would be an area, and hopefully including the Pacific Islands, which need it as well, that where we can be confident of the competence of the people within the area on managing COVID, and I think of being on top of the understanding of what it is to live in it and with it.
Your thoughts?
Okay. First of all, I think that now that so many people of so many ages who thought they weren't technologically competent have actually got their heads around using Zoom, that it's going to be usable far more so. I do about 50 talks every year to Probus and Zonta and Rotary and so on. And I suspect that groups in the country will now be ringing up and saying, hey, you know, can you do a Zoom meeting for us? And I'll be happy to do so. So that we've to some extent realized that it's not necessary to bring a body a vast amount of space, you know, into a particular location. That said, Probus Clubs are an enormously important social glue function for the people who are their members. And they get a great amount from meeting and simply being humans in shared social space together. And I don't think we ought to give that away. But from the point of view of the universities, they've been teaching online now for the best part of most of the semester. And I know a number of people in medicine who are doing telemedicine and also tele-veterinary health, and able to reach patients who would otherwise have had, you know, maybe to travel 12 hours or something to get to the surgery. In other words, this has blown our minds open a bit to the use of technology where we can do something about the tyranny of distance. That's a lovely phrase. It was the title of a book by my friend and colleague Geoffrey Blaney, where he says that living in Australia is a matter of getting your head round huge distances and how you can live in ways which accommodate it and to some extent conquer it. And I think that the Zoom thing is likely to give us a chance to do things for people, particularly in non-urban areas, which is not possible before. I'm quite hopeful.
Hmm.
Before COVID, I'm afraid the standard of political factual frankness in Canberra wasn't very good. And certain things were said and presented as facts which weren't. Since COVID, I think a lot of our public service people and government have realized that frank, open government is in fact a good way to go. And people are responsible consumers of facts and will respond to things which they ask to do if they see that there's a good rationale to it. The fake news stuff, and particularly social media, and also some of the established media who have very strong political views, both left and right, I think has misled a lot of people. And it's also helped the COVID thing to be politicized to left and right in ways which are not in the interest of a good medical outcome, to the point where often you simply don't know what to believe.
Mm-hmm.
Now, the other day, Zuckerberg was taken to task by Mr. Trump for trying to indicate the truthfulness or otherwise of a tweet. And if there is no ability by the social media to either take responsibility for or control what's going on, then it's going to be awfully hard to work out what's true. The New York Times has a team of 17 people whose sole job is working out what is truthful in order that they may print it. There are a lot of newspapers that, I'm afraid, don't do that. But the other day there was a court decision in Australia that social media are in fact responsible for the stuff they broadcast, and that is going to make things quite significantly more difficult for the people who propagate fake news. There has in the past been a certain amount of dissatisfaction with royal commissions and things, you know, feeling that they hadn't really got to the nub of the matter and got the facts out. The way in which the information machine has run with COVID, I think, has been a bit of an eye-opener for a lot of people. Mind you, medicine has had a pretty good rapport with the people over factual things for a long while anyway. But I do hope that we will now be a little more discerning of the way we consume information. In other words, if we are given information, we ask questions, the other person's got persuasive, well-informed answers, then we will know that this is in fact part of the truth that we can take on board. And I think it's an interesting growth of maturity of our democracy that this has happened. The other one I thought that was very, very indicative is the fact that we have not politicized the entire COVID thing. It can be politicized, and there are other countries where it has been. And the fact that both our major political parties refused to get involved in any kind of mudslinging over this and formed a kind of de facto national unity thing also helped, I think, the plausibility of the information that was coming our way. In other words, we've grown up and we're doing it nicely. I think it is true that over the last couple of years, the political games of Canberra have not been very impressive in some cases. And there have been lots of issues where I felt that they were not representing the people who'd elected them. On the other hand, I think that, I used to teach Russian, so I've done a lot of reading of the Russian press. There are many places where our version of democracy looks like somewhere, in an unknown place that we do it not bad. I think we will have learned some lessons as a result of this, and I hope that people will realize that there have been some bad things, but there also have been plenty of good things in the past. And what really interests me is, I think, the way in which we take on board the lessons of the COVID thing and make, if possible, the way we do things a bit better in future.